Our first speaker is Dr. Parkas Mansokani, known as Park. Uh, he was one of my outstanding fellows at the UPPGH Medical Center way back 1988 when I was the chair. And true to form, he has done well in his advocacy and his field in Davao and the Mindanao area. He is also presently the chair of the Council on Health and Integrative Medicine of the PCCP and has worked tirelessly for the past more than 10 years to make our vision of educating our people on integrative medicine a reality. So, that is Dr. Parkash Mansukani. Let's give him a big hand.
So the topic assigned to me is an overview of mainstream and unconventional medicine. Mainstream medicine is also known as conventional, modern-day, Western, and allopathic medicine. But the term mainstream has a different connotation, meaning that if it's acceptable as standard care, then you can say it's mainstream as well. So there's a little gray zone there. Okay. But for intents and purposes, not to muddle everything up, when you speak of mainstream, this would be the conventional or the Western form, or modern day, or allopathic medicine. Now, the objectives are there in your program, just to remind you, would be an overview of alternative, complementary, integrative, and the holistic approach to health, insights on the use of complementary and alternative medicine from the American Cancer Society, which came up with recent guidelines, and flowcharts for wellness and for treatment, which you may want to employ, or those who want to access the website of the PCCP later may want to employ. So first, for definitions. When we say alternative, it means that non-conventional therapies are used alone. Okay? So it's a world of either or, okay? Just used alone. Okay? When you speak of complementary, that's when non-conventional and mainstream therapies are combined, or used together, and this is in the world of both and. And when you speak of integrative medicine, the definition is not clear-cut, but the best definition, I believe, is when you combine complementary and alternative approaches with some high-quality scientific evidence of safety and effectiveness. This would be what I think would be the best definition of integrative medicine. Now, the National Center for Complementary and Alternative Medicine of the NIH, National Institutes of Health, 2000, when they came out with this 2001 to 2005, they broke it down to different domains, 5 domains. Now they just consider it actually just standard care, alternative, and complementary. But I thought the domains were still good because it gives you an idea of the different complementary and alternative approaches. Okay. First down here would be alternative medical systems. It'd be like comparing apples and grapes because they're totally different actually. You have allopathic or Western medicine would be one, but that would be mainstream, right? On top of that, alternative medical systems would be homeopathy, naturopathy, and Ayurveda, Unani medicine, and the others. For energy therapies, this would be Reiki, magnets, and Qigong. You have the external and internal Qigong. Biologically based approaches would be diets, herbs, and vitamins. Manipulative and body-based therapies would be massage, chiropractic, and osteopathy. And mind-body interventions would include yoga, spirituality, relaxation, meditation, and more mainstream now is mindfulness. Now, there are some contributions of the non-conventional approaches before, which are now considered mainstream. So again, the gray zone for the definition of mainstream or standard of care now. Okay? And this would include a holistic approach to patient care, previously just complementary alternative, lifestyle modification, patient education, wellness medicine, palliative medicine, stress management, issues in death and dying, patient-centered medicine, and mindfulness applied to medical practice, which is mindful medical practice. Now let's talk a bit about the holistic approach to patient care. When you speak of holism, it's an approach which at its core is a concept where the whole is made up of interdependent parts. Okay? When you speak of that also, on top of that, another principle which is involved here is that the whole is greater than the sum of its parts. So when you speak of holistic, it's actually an adjective which can be applied to just about any discipline or any situation. So you can have a holistic form of anthropology, holistic education. So it's an adjective when you speak of holistic. I remember a patient coming up to me once and saying, "Doc, magpapa-holistic ako, Doc." Okay, so semantically it seems to be correct. It seems to be correct. Okay. Now, holistic medicine is when you have this holistic approach applied by a health practitioner, any tradition. So it may be Western medicine, maybe Eastern medicine. The approach is holistic. And the terms usually employed when you come up with this approach would be the mind-body connection in the approach towards a holistic approach to a person, mind, body, spirit, physical, mental, emotional, spiritual. Now you know of psycho, neuro, immuno, endocrinology, gastroenterology, all in one, right? So that's a holistic approach to health. Now there's certain central components or concepts in the holistic approach to health, and these are important. That would be the differentiation between disease and illness, and the differentiation between pain and suffering. Now, when you speak of disease, this is something that happens to organs, and illness is disease plus the meaning it gives to people, okay, or something that happens to people. An example of disease would be somebody with chronic obstructive pulmonary disease. Okay? An example of illness would be Mr. Benedict Zanoria, a 60-year-old man, sole breadwinner, with difficulty in breathing and on home oxygen therapy, who came in because of an acute exacerbation of COPD. So disease would be the person in ICU bed 1, okay? While illness would be that specific individual with all of the different components of his persona and system as having a disease, right? Having an illness. So one way of looking at this, and one way to modify it, if you have patients or your loved ones admitted in the hospital, try putting up pictures of them engaged in their favorite activities or together with their loved ones, Then that puts the sense of meaning and persona on top of the disease. It now becomes more of an illness. Another concept which would be important is the differentiation between pain and suffering. Pain is a distressing sensation in a particular part of the body, like chest pain, while pain plus the meaning that it entails would be suffering. Okay? So chest pain would be just chest pain, would be an example of chest pain. And suffering would be, say, what has happened to Miss Gina Torres, who because of her chest pain believes she's having a heart attack and is surely going to die. This is what we mean also when we say that pain is inevitable, but suffering is optional. Okay? This is also why we sometimes add antidepressants for people in chronic pain. Okay. Now, another central concept of the holistic approach is the difference between treatment and healing. Now, in terms of the origin, treatment is usually external when you take in medicines, do surgery in your patients, while healing is internal and allows the body to restore itself to its homeostasis, in a sense. Now, in terms of dimension, treatment is usually concerned with just the physical, while healing addresses the whole person. So you're talking about cancer care, the session after this would be a short AVP presentation talking about comprehensive cancer care. Okay? So that's looking at all the dimensions of the person, the physical, the mental, emotional, social, and spiritual. The definition of health from the WHO, if you remember, is not merely get sick and we die. If you have any other formula, let me know and approach me later after this talk. Okay, so it's part of the process of life, and that's where palliative medicine comes in, or palliative care comes in. In terms of state, treatment is a goal to be reached. Like, say, for example, you're treating somebody with pneumonia, so you have defervescence or a drop in fever, the WBC goes down, the chest X-ray is improving, the saturations are improving. These are definite where they have not been carefully reviewed. Now, the problem with that, if you have no good editorial review board, is some of these studies have flaws methodologically. Okay? So they have flawed methodologies, and because of that, they get into journals which sound like very good journals, and physicians and patients looking at the studies can take the results or the conclusions on face value. So that can be misleading sometimes. So let's be careful. Now, these are some examples of complementary methods which some people have found helpful and safe when used with standard medical therapy. Acupuncture, aromatherapy, art therapy, biofeedback, labyrinth walking massage, meditation, music therapy, prayer, spirituality, Tai Chi, and yoga. You'll see here that most of these approaches are actually mind-body approaches, except for acupuncture and probably massage and Tai Chi. Depends how you look at Tai Chi. All of them except acupuncture are non-invasive, meaning they do not penetrate the body. Okay? So for mind-body approaches, they're relatively safe and they're very complementary. Now, they also propose these questions. When you answer yes to any of the questions, it should make you strongly suspect that the treatment is fraud or questionable. Okay? So as I think Bing was mentioned a while ago, this is going to be available to a wide audience, not just physicians. So if they see this, hopefully this can serve as a guide to them. Does the treatment promise a cure for all cancers? So if the answer is yes, suspect. Okay? It may be fraud, it may be questionable, maybe not, but you should suspect it. Okay? Are you told not to use recommended or standard medical treatment? Does the treatment claim to offer benefits but no side effects? No? Even herbs and vitamins have side effects. I've lifted this from the position paper. If the treatment is marketed as having no side effects, it's likely it's not been studied in rigorous clinical trials where side effects would be seen. Is a treatment or drug only offered by one person or clinic? Okay, suspect. Does the treatment require to travel to some other country? Okay, so you should suspect that already. Okay, do the promoters use terms like scientific breakthrough, miracle cure, secret ingredient, or ancient remedy? Are you offered personal stories of amazing results, but no actual scientific evidence? Yung anecdotes lang, as we call them. And do the promoters attack the medical or scientific community? So if you answered yes to any or all of these questions, then you should suspect that this may be fraud or questionable in terms of treatment. Now, evidence-based medicine is actually the basis for good medicine. Some people say you should not classify medicine to mainstream, conventional, alternative, just what is good medicine. So if you're looking at good medicine from that perspective, good medicine is evidence-based medicine with the best evidence possible. And Tony Dance is going to talk about that in the next plenary session. Okay? Tony Dance is considered one of the fathers of evidence-based medicine in the countries. So the triad of evidence medicine would be individual clinical experience. That's why we're going through training in medicine. Best available clinical evidence, and sometimes, if not oftentimes forgotten, the patient's values and expectations are also very important, okay, for good patient outcomes. Okay? So all three have to be there, ingrained, for good patient outcomes. Now, the next three slides are my take on these three triads and how to approach wellness and treatment. This is not evidence-based, but something that you can probably use and work on. No? This hasn't been validated, but interesting to look at. So if you're aiming for wellness or prevention, and there's good evidence or generally not harmful, examples of this would be here below. Okay? Lifestyle change, stopping smoking. We don't have to harp on that anymore. A healthy diet, regular exercise, weight management, adequate sleep, stress reduction for wellness or prevention. Vaccination, we're going to have somebody talk about the myths and misconceptions about vaccination during the luncheon symposium. Think of it this way: if we didn't have these vaccines available, then maybe our parents were not born and we wouldn't be here right now listening to this stuff. Okay. Disease screening would be important. However, the thrust now is to screen diseases in specific populations. No? General screening may not be as effective from an evidence-based standpoint, and Tony Dance is really against that, actually. I'm not sure if he's going to mention it. But say, for example, if you'd like to use CT scan, low-dose CT scan, for screening patients with cancer, it's recommended that it's done in those who are aged 55 to 74 years with more than 30-pack years smoking history, who either currently smoke or have quit within the last 15 years. So this would be the subgroup of patients where a low-dose CT scan would be most effective for disease screening. And complementary alternative approaches which are non-invasive and do not entail the ingestion of substances. Okay? So mind-body approaches would be relatively safe. However, if you're aiming for wellness or prevention, but there's a lack of evidence of efficacy and safety or potentially harmful, then my recommendation is to avoid it. We've seen patients admitted in the emergency room, patients for screening, and I used to do screening for the Canadian, Australian, and New Zealand embassies, and their LFTs are high, liver function studies are high, tests are high, and they're on some herbal products. When they stop it, it goes back to normal. And some had come in with because of hepatic failure and renal failure because of taking some of these approaches which haven't been well studied. Okay. So again, that's my take on that. Now, how about for treatment, no? Or for an holistic approach to health or treatment in this page when you want to undergo treatment? The first point is to have an established medical diagnosis, of course. In terms of established medical diagnosis, this is where the gold standard would be important. If it's a malignancy, the gold standard would be a tissue diagnosis. And if you're not sure, then you should probably go for a second opinion. Okay, so that's what I mean by an established medical diagnosis. If the cure or you have good control with Western medicine, examples would be emergency or trauma, long bone fracture, say for example, bacterial, fungal, or parasitic infection, say bacterial pneumonia, complex medical problem, congestive heart failure, stroke, kidney failure, need for surgery, appendicitis, hormonal problems, say for example hypothyroidism, then this would be some of the examples where there's good cure or good control with Western medicine. Then you can use Western medicine alone or combine with mind-body interventions, which are not harmful. However, if the cure or you don't have good cure or control with Western medicine, then you proceed to the next figure. Now, which are these conditions where you have poor control or no cure with Western medicine? One would be viral infections. A common cold. Actually, don't need to take anything for that, no? Or for systemic viral infections. And the more medicines you take for that, the higher the risk of side effects. Okay. Most mental and psychosomatic illnesses, an example of that would be schizophrenia, say for example. Allergy and autoimmune diseases, SLE, psoriasis, rheumatoid arthritis. Most forms of advanced cancer. When I came up with this slide before, most forms of cancer, I modified that to most forms of advanced cancer now. Okay? If there's no cure or good control with Western medicine, then you may probably, with good judgment, that's judicious choice of CAM therapy, might want to go there. If you do that, is there good evidence of efficacy and safety? Is the treatment standardized, and do you have a qualified practitioner or not? Okay. If yes, then you discuss with your health practitioner before starting CAM therapy. An example of this, which is now mainstream actually in the UK, no? It's called mindfulness-based cognitive therapy. Okay? So in severe depression, not schizophrenia, but severe depression. In severe depression, when you have a relapse of when you have 3 or more episodes of severe depression, the relapse rate is 90% or more. Okay? So they divided these patients into 2 groups. One group with standard therapy, pharmacotherapy, as well as psychotherapy. The other group with pharmacotherapy and psychotherapy and mindfulness-based cognitive therapy. And they found out in a double-blind randomized clinical fashion that the relapse rates was 50% less. Significant. So again, it's a mind-body approach. So that would be. But before getting into mindfulness-based cognitive therapy, you have to make sure, that's why it's important to approach the health practitioner, that these patients are stable in their disease. No? Otherwise, if they're not stable and they start to become aware of their negative thoughts, this might overwhelm them and it might drive them to do something bad. Okay? So that would be an example of judicious use of CAM therapy. How about where Western medicine alone, where no cure or poor control with Western medicine, and then you don't have good evidence, say for example for the role of Western medicine, or even good evidence for the role of CAM therapies. An example of this would be most forms of advanced cancer, say for example. Okay? So if you have advanced cancer, there's very little data on the efficacy of CAM therapies actually, in terms of efficacy and safety. Okay? So you can opt for Western medicine alone or combined with mind-body interventions. If you're satisfied, that's okay. But if you're not satisfied, then you have to look at other things. The third component of the triad I mentioned. Examine your personal values and beliefs. This is where it becomes a bit soft, right? Not hard science here. Evidence-based, or are you hoping that the cancer will go away, as an example? Okay? Look at the cost-benefit analysis, not just financial cost, but cost in terms of side effects, cost in terms of safety, cost in terms of suffering, and everything down the line. And if you still do not know, then you probably need to connect inside and find that physician inside and listen to the inner wisdom and probably decide if you want to use the CAM therapy. And if you want to use that CAM standard of that therapy, then maybe talk to your health practitioner first. The next few slides, as you probably already know, if you haven't picked it up yet, I'm actually very excited about mindfulness because it's evidence-based. So mindfulness actually is an evidence-based strategy. It's a mind-body approach, which through regular practice has been shown to increase health and well-being, help manage stress, reduce anxiety and depression, improve relationships, and increases one's appreciation for the beauty of being truly alive. Now, because of the research in mindfulness, the United Kingdom last month, actually October 20, I still remember the date last month, the United Kingdom has actually come up with a position paper and with the intent of becoming a mindful nation. So they're integrating mindfulness in healthcare, in education, they're integrating it in the workplace and integrating it in the criminal defense system already. And you can just Google that, UK mindfulness, and you can download the whole document in that regard. Now, if you'd like to find out more, we don't have time for that, of course, this morning. If you'd like to find out more about mindfulness, log on to mindfulness.ph and click on mindfulness. The website's being developed now, and you can find out more about what mindfulness is. Okay. So I'll leave you with the last slide, which I have actually is something to think about. It's about Rachel Naomi Remen, and she says that illness can be considered a Western form of meditation. Thank you.